Hair loss. Hair loss, alopecia, can influence simply your scalp or your whole body, and it very well may be transitory or lasting. It very well may be the aftereffect of heredity, hormonal changes, ailments, or an ordinary piece of maturing. Anybody can lose hair on their head, yet it's more not unexpected in men. Hairlessness commonly alludes to over-the-top hair loss from your scalp. Inherited hair loss with age is the most well-known reason for sparseness. A few group like to let their hair loss run its course untreated and unhidden. Others may cover it up with hairstyles, cosmetics, caps or scarves. Also, still others pick one of the medicines accessible to forestall further hair loss or re-establish development. Prior to seeking after hair loss treatment, talk with your PCP about the reason for your hair loss and treatment choices. Manifestations. Hair loss can show up from numerous points of view, contingent upon what's causing it. It can come on unexpectedly or progressively and influence simply your scalp or your entire body. Signs and indications of hair loss may include progressive diminishing on top of head. This is the most well-known kind of hair loss, influencing individuals as they age. In men, hair frequently starts to retreat at the hairline on the brow. Ladies ordinarily have a widening of the part in their hair. An inexorably normal hair loss design in more established ladies is a retreating hairline, front-facing fibrosing alopecia. Roundabout or inconsistent bare spots. A few group lose hair in round or inconsistent uncovered spots on the scalp, facial hair or eyebrows. Your skin may get bothersome or excruciating before the hair drops out. Unexpected slackening of hair. A physical or enthusiastic shock can make hair relax. Small bunches of hair may come out when brushing or washing your hair or even after delicate pulling. This sort of hair loss normally causes in general hair diminishing yet is brief. Full body hair loss. A few conditions and clinical therapies, like chemotherapy for disease, can bring about the loss of hair everywhere on your body. The hair typically becomes back. Patches of scaling that spread over the scalp. This is an indication of ringworm. It very well might be joined by broken hair, redness, growing and, on occasion, overflowing. When to see a specialist. See your primary care physician in the event that you are troubled by tireless hair loss in you or your youngster and need to seek after treatment. For ladies who are encountering a retreating hairline, front-facing fibrosing alopecia, talk with your PCP about early treatment to stay away from critical perpetual sparseness. Likewise, converse with your primary care physician on the off chance that you notice abrupt or sketchy hair loss or more than expected hair loss when brushing or washing your or your kid's hair. Abrupt hair loss can flag a basic ailment that requires treatment. Causes. Individuals commonly lose 50 to 100 hairs per day. This generally isn't perceptible on the grounds that new hair is filling in simultaneously. Hair loss happens when new hair doesn't supplant the hair that has dropped out. Hair loss is regularly identified with at least one of the accompanying variables. Family ancestry, heredity. The most widely recognized reason for hair loss is an inherited condition that occurs with maturing. This condition is called androgenic alopecia, male design hairlessness and female design sparseness. It normally happens step by step and in unsurprising examples, a retreating hairline and bare spots in men and diminishing hair along the crown of the scalp in ladies. Hormonal changes and ailments. An assortment of conditions can cause perpetual or transitory hair loss, including hormonal changes because of pregnancy, labor, menopause and thyroid issues. Ailments incorporate alopecia areata, alopecia areatuh, which is invulnerable framework related and causes sketchy hair loss, scalp contaminations like ringworm, and a hair pulling issue called trichotillomania, trichotillomania. Drugs and enhancements. Hair loss can be a symptom of specific medications, for example, those utilized for disease, joint inflammation, sorrow, heart issues, gout and hypertension. Radiation treatment to the head. The hair may not develop back equivalent to it was previously. An exceptionally upsetting occasion. Numerous individuals experience an overall diminishing of hair a while after a physical or enthusiastic shock. This sort of hair loss is impermanent. Hairstyles and medicines. Extreme hairstyling or hairstyles that pull your hair tight, like ponytails or cornrows, can cause a kind of hair loss called footing alopecia. Hot oil hair medicines and permanents likewise can make hair drop out. In the case of scarring happens, hair loss could be lasting. Hazard factors. Various variables can expand your danger of hair loss, including a family background of thinning up top on your mom's or father's side, age, huge weight reduction, certain ailments, like diabetes and lupus, stress, helpless nourishment, anticipation. Most hair loss is brought about by hereditary qualities, male design sparseness and female design hairlessness. This kind of hair loss isn't preventable. These tips may assist you with staying away from preventable kinds of hair loss. Be delicate with your hair. Utilize a detangler and abstain from pulling when brushing and brushing, particularly when your hair is wet. A wide-toothed brush may assist with forestalling pulling out hair. Stay away from brutal medicines like hot rollers, hair curling accessories, hot oil medicines and permanents. Cut off the pressure on hair from styles that utilization elastic groups, barrettes and plaits. Get some information about meds and enhancements you take that may cause hair loss. Shield your hair from daylight and different wellsprings of bright light. Quit smoking. A few investigations show a relationship among smoking and sparseness in men. In case you're being treated with chemotherapy, get some information about a cooling cap. This cap can decrease your danger of losing hair during chemotherapy.